mandibulectomy, we are going to encounter difficulty sometimes with closing our mouth, moving the tongue around from side to side, and food hiding in our lower jaw. These exercises are designed to help improve recovery of sensation, feeling, lymph fluid, and muscle activity. We are going to encourage that you pair these exercises with passive range of motion, which is helping to move the circulatory system, active range of motion, which is pumping the muscles and getting the lymph fluid movement, as well as improving your overall function and quality of life goals. So follow along with us, and don't forget to download at the end our 10 exercises to help you after a mandibulectomy.
Let's start. The first exercise is pucker labial exercise.
Open your mouth and try to pucker while your mouth is wide open. Try not to close your jaw. Hold this and then relax and repeat.
The second exercise is pterygoid release and jaw stretching.
The pterygoid release, our patient's going to start in a supine position, lying down. We're going to encourage them to bend your knees. Now go ahead and breathe out. Now, I'm going to place my finger along the inside of their molars, have them close their jaw, and I'm going to be able to slide my finger further back along that region. In this area, I'm going to be feeling for a softening of my patient's tissue. I really do like to do this in two ways. I'm going to have my patient open. Now I'm going to slide my finger back, close, and then I'm feeling for a pterygoid release. One of the things I could consider is that if I'm not comfortable behind my patient, I'm going to come a little bit in their personal space. I'm going to go ahead and I'm going to have my patient open their mouth. I'm going to go along the opposite side, close your mouth, and now I'm going to feel for that softening of the tissue between the very last molar and the posterior part of their maxilla. So I'm really going along that top jawline. Patient closes, and here my finger is able to push very sensitively along that region. Sometimes I like to feel and give it pressure. Now this can be a very hypersensitive area for our patients. Please be very cautious as you go in their mouth, and of course respecting their gag reflex. If they have one, this may not be a choice for you, but we can also teach our patients to go in there and complete this themselves.
Our third exercise is Scalene Neck Stretch.
This is stretching our scalene muscles, the muscles utilized in our neck. We are going to sit, place our hands under our collarbone. Now, when we place those hands under the collarbone, we are going to pull down towards the floor, towards the top of our stomach. With that chin, we are going to turn to the opposite side, lean it away from the hand, and stretch, feeling it along the side of the neck. We are going to sit, place our hand under our collarbone, pull down towards the floor. Our hand is going to go towards the top of our abdomen. Now look in the opposite direction. Our chin will be tucked in the opposite direction of our hands, leaning our head sideways towards the shoulder. And then we will feel a stretch along the side of the neck. Hold this stretch. Whatever we do to one side of the body, I love for you to do to the other side.
And our fourth exercise is neck flexion and extension.
During this exercise, we are going to sit in a chair upright with our chin starting in a neutral position, breathing in and out to work our lymphatic system. Now drop our chin to our chest, hold for a moment. Now slowly lift up, reaching for the ceiling. Relax, chin to the chest, hold for a moment. Now slowly lift up, reaching for the ceiling. Hold and relax. Keep with your deep breathing throughout the entirety of the 10 repetitions.